probably tied to what we're talking about here. Certainly when you watch the news today, you think about healthcare crisis and people having access to care or affordable care and all the things that we read in the media. And in my mind, that is probably one of the biggest concerns that we have as a fund because it's out of control. As chairman of a benefit fund, I have a unique experience in dealing with better ways to deliver health care. So when I look at what we do today with our point solutions like Lantern, we have created a system at the CB&T that literally has taken healthcare inflation out of the equation. And I say that because our fund has seen like 1% healthcare inflation a year for the last 10 years. And it started a number of years ago when we put wellness in, and wellness started to build into some of these point solutions, and today we have 21 point solutions on our fund. And so it's work, but when I see the healthcare landscape today, there's ways to deal with this if you're willing to put a little bit of energy into it. As the future goes, I think for benefit funds, continuing to develop solutions that deal directly with providers is really becoming what I think providers want, because providers, doctors especially, they want to practice medicine. They don't want to deal with insurance companies. They don't want to deal with mounds of paperwork for billing and all that kind of stuff. They want to provide health care. And I think when you look at what a Lantern does and some of the other point solutions that we utilize, it really is a great way to deal with these future costs as we go down the road, because I think you're going to see more and more of a buy-in from both benefit funds, participants, and certainly providers.
The experience I had around, like when we talk about this question, when did you see healthcare work well? Well, I spent many years in a volume-driven practice where I was seeing 25, 30 patients a day, and I didn't feel like it was working well, and it was really hard to feel like you were having an impact. And to Carl's point, I didn't get into it to have a volume play and have everything I was doing be driven by financial incentives. I got into it to help people. And so by practicing in an advanced primary care setting, a dedicated clinic, which Carl, I know you have a vendor in place to do that, it allowed me as a provider to spend more time with my patients and to really do a deep dive around what was really wrong, but not just throwing meds at the patient, but to be able to ask holistically how I could help them in that moment. And so by doing so, I was able to not only address their immediate needs that maybe brought them into the clinic, but by having a time and structure behind me and being able to practice independently, not owned by a giant system that was only incented by high cost dollars, right? I was able to actually sometimes make huge impacts in people's lives where, maybe it was a diagnosis they were carrying for years that no one was able to uncover, or they didn't feel comfortable expressing what was actually wrong because they were already on a time clock when they came in the clinic, And so being able to practice in that setting not only informed further the kind of work I wanted to do in healthcare by trying to make a difference more globally, but it also helped me see how broken things were. If as a provider, I don't have the freedom and flexibility to really cater to my patients' needs or have the visibility into what the downstream impacts are if I need to refer them into the system outside of primary care, that's an injustice to our patients, to our people. And for a system that spends so many dollars in healthcare, it is unacceptable how broken it is and how members, patients, individuals don't have visibility into the care journey and feel very helpless and powerless. But as a provider too, I would argue that many providers feel like they don't have that visibility either, and frankly don't have the time or the energy to care about it.